Welcome to an introductory video demonstrating the techniques required for the safe administration of parenteral nutrition in the home setting. This video was created by the Nutrition Support Service at the University of Chicago with the intention of demonstrating appropriate catheter care, safe handling and administration of the parenteral nutrition solution, and monitoring for complications related to home parenteral nutrition support. Adequate nutrition is essential to normal aspects of growth and healing, and provision of nutrition support has a growing body of evidence for the prevention of complications in the setting of surgery and among individuals who are unable to consume adequate calories. The primary means of nutrition support includes the administration of calories via parenteral route, referring to intravenous support, and via enteral route, or through the gastrointestinal tract. If a patient is unable to tolerate adequate nutrition via the gastrointestinal tract for prolonged periods of time, parenteral nutrition, at times referred to as PN, is an option to provide both calorie and fluid requirements to sustain weight, promote wound healing, and meet daily energy requirements. Parenteral nutrition is a mixture of water, electrolytes, carbohydrates, protein, and fat, which are formulated under the direction of dietitians, nurses, pharmacists, and physicians, and tailored to meet the individual needs of the patient. Use of parenteral nutrition is started in the hospital, and in specific circumstances, solutions can be created for administration in the home setting. For safe delivery of parenteral nutrition at home, we suggest formal hands-on teaching for catheter care and parenteral nutrition setup. Additional support is available through visiting home nurses and from home care companies. Prior to discharge from the hospital, your physician team will need to certify appropriateness for discharge with parenteral nutrition. Given the concentration of the parenteral nutrition solutions, delivery into the small veins of the hand or arm can result in significant damage to the veins. Therefore, specialized catheters called central venous catheters are required for safe administration of parenteral nutrition solutions into the large veins of the upper chest. Here, the parenteral nutrition solution is quickly diluted as it enters the bloodstream. The most common forms of central venous catheters include tunneled central venous catheters, peripherally inserted central catheters or PICC lines, and ports placed under the skin. Tunneled central venous catheters are most commonly seen exiting the upper chest. PICC lines are placed in the upper arm. Ports are placed under the skin in the upper chest and are commonly used for chemotherapy. When indicated, their use can be extended to include the administration of parenteral nutrition. Catheters have individual differences with respect to composition material and individual risks of clotting or infection. Therefore, formal recommendations for catheter placement should be made under the direction of a physician. Catheters entering the skin, either in the upper chest or upper arm, are covered with a transparent dressing, which will require replacement by a trained professional 1 to 2 times per week. The transparent dressing allows for inspection of the skin at the catheter entry site to ensure the skin remains free from infection. In the setting of excess sweating or moisture collection under the dressing, your home care nurse or managing physician should be notified to schedule replacement of the dressing. Dressing changes should always be done in a sterile fashion by a trained professional. In the setting of spreading redness at the skin entry site, your physician should be notified in concern for an infection. In order to keep the catheter entry site free from infection, we recommend that patients do not go swimming or submerge the catheter underwater. When showering, specialized waterproof covers can be purchased or fashioned from plastic wrap in order to keep the catheter site and transparent dressing dry. Now we are ready to begin setup of the home parenteral nutrition solution. When first starting, we recommend allotting 1 hour for parenteral nutrition setup, but as you become more comfortable with the administration process, setup will require 15 to 20 minutes. Solutions are ordered by the prescribing physician and delivered to the house by a home care pharmacy. Parenteral nutrition solutions are kept refrigerated in order to preserve the integrity of the solution. Prior to use, a single parenteral nutrition bag should be removed from the refrigerator 4 to 6 hours prior to use in order to bring the solution up to room temperature. We do not recommend warm towels, hot water baths, or alternative means to heat the solution, which can damage the integrity of the parenteral nutrition. Prior to setup, it is recommended that the parenteral nutrition solution be prepared on a clean, firm, and dry surface and away from pets, fans, or open windows in order to prevent contamination of the catheter or solution. Wash your hands with antibacterial soap and water thoroughly, paying close attention to your fingertips and under your nails. Loose jewelry and watches should be removed and set aside. Dry your hands with a clean paper towel. Use the paper towel to turn off the water after washing your hands. Gloves are not mandatory for safe handling of the catheter, as long as attention is paid to sterile techniques and adequate hand washing. If gloves are used, ensure a glove size is chosen that does not leave excess material at the tips of your fingers. At the start of setup, gather the following supplies: the parenteral nutrition solution, 4 alcohol or chlorhexidine pads, 2 multivitamin vials, an empty syringe with needle, a saline syringe, a new injection cap, and IV tubing. The pump will require a new battery nightly, and it should be reset prior to use. Inspect the parenteral nutrition bag for any leaks, discoloration, or particulate matter. Your pharmacy supplier should be notified if any of these conditions are present. Air within the bag can interfere with the intravenous delivery and should be removed in the setup process. In order to open alcohol or chlorhexidine pads safely and reduce infection risk, we recommend using the no-touch technique to open the alcohol pads and wipe sterile surfaces. 2 sides of the pad can be cut with scissors, and 1 side of the packaging can be pulled back in order to minimize the contact of your fingers with the prep pad. The pads should be kept within the packaging when wiping sterile surfaces in order to avoid contact of your hands with the sterile surfaces. In order to prepare the multivitamin solutions, remove the top cap off of the multivitamin vials. Wipe each vial top with an alcohol swab for 15 seconds. Remove the foil from the medication port of the parenteral nutrition solution, wiping it with an alcohol swab for 15 seconds. Ensure that the clean surfaces do not touch your working surface or hands in order to keep the solution sterile. Remove the empty sterile syringe from the packaging, making sure to avoid touching the hub. Screw on a sterile needle. Draw up 5 milliliters of air into the syringe and inject this into the multivitamin vial to assist in drawing out the multivitamin solution. Repeat this process with the second multivitamin vial. Once both multivitamin solutions are drawn up, turn the catheter over with the needle facing up and tap on the sides to remove any air from the syringe. Inject the multivitamin solution into the parenteral nutrition solution, making sure to avoid breaking through the medication port. Rock the parenteral nutrition solution to mix in the multivitamins. Discard the syringe and needle in a red sharps container. In order to prepare the IV tubing for use, inspect the clear tubing for cracks or kinks that will obstruct flow. Clamp the end of the tubing in order to prevent leaking of the parenteral nutrition solution during setup. Remove the spike port cap from the parenteral nutrition solution and insert the catheter with a firm twisting motion. Insert the catheter into the pump and prime the tubing. Individual central venous catheters have slight differences in design, but general principles include the presence of a clamp to prevent air migration into the catheter and an injection cap attached to the end of the catheter. Ensure that the clamp is placed in a closed position when working with the catheter to ensure air is not introduced into the catheter, as this can result in a life-threatening medical emergency. Before connecting the parenteral nutrition solution to the central venous catheter, place a new injection cap onto the sterile saline syringe. Remove any air bubbles from the saline syringe and injection cap. Clamp the central venous catheter. Remove the old injection cap and wipe the catheter tip with an alcohol or chlorhexidine pad for 15 seconds. Screw on the new injection cap attached to the saline syringe. Unclamp the catheter and flush the catheter with sterile saline. Reclamp the central venous catheter. Remove the syringe from the injection cap that is now attached to the central venous catheter. To attach the parenteral nutrition solution, remove the cap from the primed IV tubing and attach the solution to the central venous catheter's injection cap. Unclamp the central venous catheter and start the pump. Once the parenteral nutrition solution is done infusing, it's time to disconnect the solution from the central venous catheter. It is not recommended to disconnect and reconnect the same parenteral nutrition solution bag, as this can result in contamination of both the solution and catheter. Therefore, it's only recommended to disconnect the parenteral nutrition solution after the appropriate time and volume have been administered. In order to disconnect the parenteral solution, open a sterile saline syringe and remove any air bubbles. Clamp the central venous catheter. Disconnect the parenteral nutrition catheter tubing and wipe the injection cap with an alcohol or chlorhexidine pad for 15 seconds. Attach the sterile saline syringe. Release the clamp and flush the saline into the catheter. Reclamp the catheter, remove the syringe, and apply a sterile swab cap to the injection port in order to keep the catheter tip sterile. Parenteral nutrition administration can come with serious complications at home, to include bloodstream or catheter infections, liver dysfunction, and blood clots, which at times can require hospitalization. The purpose of this video is to instruct on appropriate catheter care in order to reduce these complications from occurring. Therefore, any fevers, chills, shakes, or swelling in the arms or legs should be immediately reported to your physician, who can instruct you on further management. Symptoms of an infection of the catheter include pain, redness, or swelling along the catheter track, fevers, and chills. We recommend checking your temperature 1 hour after starting the parenteral nutrition infusion. If your temperature is greater than 100.4 degrees Fahrenheit, repeat the temperature in 1 hour and contact your medical provider. If your temperature is greater than 101.3 degrees Fahrenheit, contact your medical provider and seek urgent medical attention in concern for an infection of the catheter. We recommend that you avoid taking Tylenol, ibuprofen, or aspirin, or similar medications which can mask a fever and therefore an infection related to the use of parenteral nutrition. We will ask you to keep a track of your weight and contact your medical provider if your weight increases by more than 2 pounds in 1 week. If you experience changes in breathing, chest pain, or swelling in your extremities, these can be signs of fluid overload and should be reported to your medical provider immediately. If you notice that your catheter has become dislodged or that a break or leak in the central venous catheter has developed, ensure that the clamp is closed. Wrap the catheter in a sterile, occlusive dressing and contact your physician immediately. This line will require repair or replacement prior to further use. This concludes our introductory video on the safe handling and setup of parenteral nutrition in the home setting. Further support for administration is available from the Nutrition Support Service at the University of Chicago. We would like to thank our support for this video that includes the University of Chicago Medicine, the Gastrointestinal Research Foundation, and the University of Chicago Bucksbaum Institute for Clinical Excellence.